I want to ask you something. How many of you have been told at some point that either by a doctor or a physical therapist or just by life that you need to take it easy? You need to slow down at the gym. You don't want to overload the joints. You got to rest that shoulder. Or, hey, you know what? You're not in your 20s and 30s anymore. And how many of you quietly accepted that? And you started to do less. And you started to notice that doing less made things worse. Today, I want to show you something that changed the equation for me personally and for thousands of athletes and patients and everyday people who refuse to accept that their best physical years were behind them. What if I told you that you can build real muscle, trigger your body's most powerful healing hormones, and get a full training stimulus in about 10 to 15 minutes at 20% of the weight you normally needed to lift? That's not a sales pitch. That's peer-reviewed science, and it's been around for about 40 years. Blood flow restriction training uses specifically designed bands on your arms, upper arms, and upper thighs to slow blood leaving your muscles while you exercise. It creates a powerful signal that tells your body to build, heal, and grow at a fraction of the effort normally required. I want to give you a little bit of background on this to understand this has been around for about 40 plus years, and this is not something new. This was developed by Dr. Yoshiaki Sato in Japan in 1983. Noticed during a ceremony that he restricted blood flow in his legs produced a training-like pump. And what he ended up doing was he's trying to figure out how to refine the science to make it more specific and consistent and so forth. And now it's used in the NFL, the NBA, our U.S. Olympic training centers, in different, and also other countries too, but U.S. military rehab worldwide. My baseball team, I'm not part of them, but the Chicago Cubs use it, and there's like 16 or 17 MLB teams that use it. And it's fascinating what they can do because it has 40 plus years of peer-reviewed research. This is not a fringe science. This is not going anywhere. It's going to start to get popular as time goes on. And it's one of those things where I love the quote I heard one time when I was learning about these more years ago, is that the brain, your body doesn't know how much weight it's lifting. It just knows how much lack of oxygen it has going on. And I want you to remember that as we go through this. So I want you to think of it like a dam in a river. The bands slow the outflow. Blood pools in the muscle, metabolites build up, and your body interprets that as an intense workout signal. Even though the weights are light, the biochemical response is powerful, and it makes a huge difference when we're looking at things. So let's get into this. This is one thing that sold me on these a couple years ago. Well, I've been studying these now I knew about this for almost 10 years. I just didn't like some of the stuff that was out there, and I'll get more specific. But this is the number one reason when I saw this study come out that made me go, I have to get my hands on this. So let's talk about growth hormone real quick. Let's talk about what it is, what does it do, and so forth. What the biggest thing about growth hormone is it drives your muscle repair and growth. It burns fat and regulates the body composition. It builds your bone density. It speeds up cellular recovery. It supports your cognitive function. And it really starts to decline steadily after the age of 30. Most people just accept it as aging, but really it's a growth hormone thing that plays a role. We see this with children also. Why do children recover so much better and bounce back better? Well, they have high levels of growth hormone in their body. Compared to those, as we get older, we don't have as much, and that becomes a huge issue for healing and repair and for growth and all these different things. They call this our healing hormone, in other words. And so during a BFR training, blood flow restriction training, you're limiting oxygen into the muscle. It creates a massive amount of building up of metabolites, and this is including lactate. That lactate builds up, triggers a significant release of growth hormone. That's why the burn is so important when you're working out. You want to feel that. And the more you feel the burn, the more you're going to create lactate, which creates more growth hormone. These kind of work synergy together. And studies have shown that you get an actual 200 to 300% surge post-session, way far beyond what conventional weight training produces at the same intensity. And even strength-resistant HIIT training, CrossFit-like or CrossFit workouts, you'll still get about a 200 to 300% better growth hormone production post-training compared to those. So what you're doing is you're essentially hacking your body's most powerful anabolic signal with the fraction of the load. which is a game changer in just that alone, if you ask me. And I want to share with you guys my own personal story on this. I've been using the B3 bands. This is the one I specifically recommend to use, and I'll talk more about this later, for about 2 years now. And I work out 10 to 15 minutes about 3 to 4 times a week. And I have maintained my body composition. I've actually put on more muscle and my energy levels overall while training less than I've ever had in my adult life. And I've been lifting weights and working out since I was 13 years old. And this is not a coincidence. That's just growth hormone working at the nature of what it's supposed to do. And that's the beauty behind this. When you start to understand hormones, you start to understand this process, it's really about the growth hormone factor that's going to do a lot of this. And we utilize this in when I have some patients who have like maybe an injury, an adult or an athlete, we'll have them utilize these bands so we can tap into that growth hormone to help stimulate the healing process as natural as we possibly can. So this is one of the things that we can utilize. And this is one thing I love about the bands, especially for myself, because I'm always looking for longevity. That is why I've been studying that for over 20 years. And I knew about blood flow restriction bands, like I said, about 10 years ago. I started hearing about this. I knew bodybuilders used them and so forth. And I was like, I don't know about this. There's concerns I have. I'll talk about those a little later. And but when it came to the growth hormone aspect, I was like, I'm sold. Because I already know what growth hormone does. I already understand it. And to get that in just 10 to 15 minutes, and I can get that growth hormone kick, I'm sold. But that's not the only thing I loved and what sold me on there. It was something else that really helped me shift, because they've done studies on this. Now they look back during COVID and they found those who didn't get COVID. One of the things was they had a lot of nitric oxide. And there's a whole thing about nitric oxide. It'll be the new thing that's going to happen in the health world. If it's not already happening, it's going to be. I know a lot of people are pushing on to the oxygen level of things. Nitric oxide will be even, I think, will be just at that level or higher. And here's why. Because when you look at nitric oxide, what does it do? Well, it causes your blood vessels to relax and expand. This is really good for cardiovascular health and plays a role on so many different factors. Because it's really one of those things, if you're looking about heart health, circulation, brain function, these are the big things that nitric oxide is going to hit, right? So you look at improved circulation to every tissue in the body. So the better circulation you have, the more vitality and nutrients are getting to the cells themselves. When you look at things like lowering blood pressure naturally or increasing your oxygen delivery to the muscles in the brain, you have to understand, a lot of people are getting to oxygen therapy stuff. But if you're not correcting or helping with this in some way, shape, or form from a delivery standpoint, then what are you really doing? You have a bottleneck effect. So nitric oxide, when you have these higher levels of it, it's going to allow this oxygen to flow better. I mean, when I started doing these workouts 2 years ago, coffee or caffeine didn't hit me as well like it used to when I was like in chiropractic school and things along that nature. Like I have a little coffee, I'd be revved like this. What ended up happening was as I started doing these workouts and some other things, and coffee hits me a lot harder, actually harder than what I used to. So I have to drink less. Not that I drink a lot, it's only a cup, but I have to go less than that, or I shift it to a shot of an espresso. So that way I don't have so much of that like jitter in my going, because in like this energy, it's just crazy how much shows up. But the cool thing about this too is that nitric oxide declines significantly with age and sedentary behavior. So we lose this as we age, and we lose out on a lot of these benefits. That's why cardiovascular issues show up, libido stuff, ED for men, a whole variety of things will start to show up. Our blood pressure goes up higher. It's because they don't relax like they used to, because we don't have a lot of nitric oxide. But it also has an immune factors that I didn't put in here in the workshop, but there's a lot of studies they've done with the immune system and how important nitric oxide is and what it does for that. And like I said, it's going to be the new thing that you're going to hear about, probably not now, maybe another 2 to 3 to 4 years, where it's going to really do that. But here's the kicker. This is how BFR truly activates this. So the intermittent occlusion, right, is tightening up short in the perfusion cycles, right? So in and out, blood flowing through there. What it'll actually do is it stimulates the nitric oxide production and increases your capillary density. This is very critical, and I'll talk about this in a second, because it'll enhance then more oxygen delivery and nutrient transport. So I'll say this, and then I'll get into something a little deeper. But better nitric oxide means better blood flow to the brain, the heart, the muscles, the joints. This is why BFR isn't just a fitness tool; it's a vascular health tool. Okay, but I want to say this though: when it comes to that, I want you to understand that the whole stent's about occlusion and perfusion, and what does that do? When you work out, over time, your body's going to start to build more capillaries into the muscles because you have a bigger demand for things there. It's like what you don't use, you lose. So the more that you're working out, the more you stimulate the system. Eventually, over time, you're going to build more capillaries in there. You're going to get more oxygen flow. That's why people who like work out and runners, when they're really activating these systems properly, you'll notice their skin color has more of a glow to them versus someone who doesn't work out. And that's oxygen delivery systems, nutrition delivery systems, and so much more. So this is the same kind of concept here. And what we're doing is it uses that system and actually instills increased capillary density in the muscles and so much more. So you're getting more blood flow to these different areas, which is going to benefit you way much in the long run. But here's some other things I didn't mention, and it says on the bottom of the slide here, but IGF-1 is your muscle and bone growth. I'm going to share some stories about that. Beta endorphins. This is your natural pain suppression. It enhances insulin sensitivity. I can't tell you how crucial that is. This is one of the reasons for me, from a longevity standpoint, I always want to make sure I keep my insulin as sensitive as possible. And this is, again, another tool. I don't have to work on different supplements or have to do specific type of fasting or all the things I do. Instead, I know that my workouts are strictly increasing this effect even more. So you get this full hormonal cascade from one short BFR session, and it's about 10 to 15 minutes. Shoot, when you first start this as a beginner, it's like 3 to 5 minutes, and it takes 10 minutes, no more than that. And you can go longer. I've had some sessions go up to 20 minutes sometimes when I really want to stress my muscles like crazy. But most of the time, it's about 10 to 15 minutes is where I keep my workouts when it comes to this. So I want to share this, though, because if you're listening to this, you're like, wow, I'm very intrigued. Who's this for? Right? So who's going to benefit from this? Well, if you're over 40 and recovery takes a lot longer than you used to, this is for you. If you have a joint tissue, knee, shoulder, hip that limits how hard you can train, this is for you. If you're post-surgery or post-injury and you need to maintain muscle without stressing the repair site, this is for you. If you're a busy professional with 15 to 20 minutes and not 90, this is what got me, because I was like, I don't have a lot of time. Working out's very critical for me, but I'm not going to sacrifice it. But looking at my life with 2 kids, running a couple businesses, running 3 offices, my time is very, very limited, just like anyone else's. And I was like, how can I maximize my time, still get the benefits, and still be able to do all those things? And that's where that came in. The one other big thing is, do you want to age well? Do you want to have good muscle mass, bone density, cardiovascular health without beating up your body? You're an athlete, though, also looking for an edge in recovery between competitions. If you're one of these, this is for you. Because BFR isn't just for the injured or the aging. Again, the NFL uses it, the MLB uses it, the military uses it, our Olympians use it, and now you can too. And that's what's cool. The chiropractor who I was talking to, he was working with one of the Olympians in the powerlifting in the last Olympics that they were there. And the guy who was doing, I think it was a deadlift or something like that. And he told the guy, hey, why don't you try out my stuff, the BFR bands, and we'll go ahead and we'll drop the weight from 500. He deadlifts 500 pounds in reps. He says, doing that, we'll drop it down to 150. And I'll have you do the same sequence. I'll increase your reps, but this is what I want you to do. And the guy's like, I don't lift anything less than 500 pounds. And he said, and he kept going back and forth. And he said, okay, fine. How about this? The chiropractor looks at him and goes, do your normal 500, whatever sets that you have to do for your training right now. All I ask is then we'll put the cuffs on after, and I want you to go ahead and lift with the 150. I want to see how you feel. He was so impressed how much he couldn't lift with that less of weight. But the more thing that impressed him was the burn. See, bodybuilders and stuff, they don't, like I remember hearing, I don't know if it was Arnold Schwarzenegger, but it was some bodybuilder. He always say, you start counting your reps after you feel the pain. You feel the burn. And that's where you get that, again, that growth hormone, the nitric oxide. That's where the real growth is. So he was very fascinated with it. So then the guy said, fine, I'm going to try this out. I'm going to do it. And so he started to incorporate it into his workouts. He won gold that year. He blew everybody by. So there's a huge power for this. It works. You could be an athlete. You don't have to be an athlete. But these things are going to be what's going to help each individual when it comes to this. Now, you're probably saying this is great. I'm very excited, but I want to be very, very, very crucial about this. This is what I didn't get involved in BFR 10 years ago. The biggest reason was safety. I was very concerned about occluding the arteries, potentially, these tourniquet type styles, because I would see bodybuilders like they'll take ace bandages and tie them real tight up as high as they can in their thighs, or do them on their arms and strap them really tight. And I would always be concerned because I'm like, you need arterial flow. You need blood flow to get to that area. And how do you know you're not slowing it down so much to where you can cause thrombosis, which is clotting? And so I was like, I don't know, man. I kept reading the studies. I was looking at different companies. I wasn't sold. And I kept saying, I put it back. I remember 5 years ago, I was almost going to get one. And I said, now I'm very concerned. I don't see the safety studies in here to tell me that really give me the confidence to know. Until I found out about B3 bands about over 2 years ago. I was at a seminar, and I remember they were like, we're going to have someone come in and talk about B3 bands and this. And I'm like, oh, here we go. They're going to just be selling us something. I don't like when they do that with a seminar. I'd rather just not listen to that and be able to cut my time down at a seminar. Just being transparent. So long story short, though, here's what happened. They present on the bands, and I remember they were telling us, like, you're not going to be able to – I see this big guy go up there, and he's like, here's a band, here's a rubber band. That's what he's using, these resistant bands. And he puts the cuffs on. And he's like, either do 30 seconds or 30 reps of bicep curls, and then 30 seconds or 30 reps of triceps. So if you do 30 reps, do 30 reps on both. And I'm going to have you just go back and forth. So what he did is he had them do the biceps for 30, and then he switched to triceps. And he said, well, I'm going to have you do that for the arms for 3 rounds. And then those who were doing legs, he was having people just do 15 squats, and then you do leg kicks back. So then you rotate that for 4 minutes. This big guy, very muscular, he stopped at 2 minutes. He couldn't even make it to 3. His arms were burning. He was sweating. And I'm like, hold up. I wasn't even going to get up there. And I'm like, you know what? Hey, can I go next? He's like, yeah. And so halfway in, he's like, you feel a burn? I'm like, yeah, I feel a burn. But, and he's like, well, I said, I just don't feel it enough. And he's like, you know what? You probably need a little bit more pressure. So he pumped it a little harder on me. And then all of a sudden I finished the workout, but I will tell you, my arms were burning like crazy. I went back to my seat and I'm like, I feel like I just did like a 30-minute bicep workout and tricep workout. My arms are shot right now from just the fatigue. And I was like, man, I want to know more about this. But then, of course, I was like, are we going to get on this after this? I'm like, what about safety stuff? I need to know. And this is where we're going to get into. Because here's the risk of when you're looking at other companies and other brands, when you look at BFR. And one of the biggest issues is deep vein thrombosis. These are blood clots that can cause fatal pulmonary emboli. What happens is it creates a clot and it gets into your lung, and all of a sudden you can't process oxygen well. It could become fatal for you. Rhabdomyolysis. This is a severe muscle breakdown that can cause kidney failure. Nerve damage from arterial occlusion. Where you don't have proper blood flow getting to the area properly, you're going to have this issue. Most cheap bands or wraps have never been scientifically tested. And this is what gets interesting, because I looked at a lot of different companies in the past, and that's why I didn't see all the studies that were there, so I wasn't okay with it. But when I got introduced to B3 bands, there was a few things that really stood out to me. There's 2 things, actually, that really was like, there's really good safety here. They don't occlude the arterial blood flow by design, which was very interesting. Because what they have, instead of like a rubber band just tying up on an arm or a leg, it's a multi-chambered bladder, scientifically tested. So they tested this in 24. That's why I got exposed to these. It just came out with the study, and that's when I was like, I'm sold, I'm getting them today. Because they found out through their multi-chambered bladder, it compresses all together at once, and it's not a tourniquet tying into things. So what they've done in their studies, they've looked and said there is no evidence of increased DVT risk, deep vein thrombosis or clots, in studies. They've looked at it and they pumped harder than they should be. You get like this certain number. They went to the max number on the arms that you can possibly pump these things to, and on the legs, and there was no DVTs. Because like they even show you, even pressure distribution, it compresses into the arm and it compresses all together at the same time into the legs. And they are very safely at risk populations, including cardiac patients. So what that means is if you have cardiovascular issues and so forth, you can use these things. Even though I don't recommend this for pregnant women, but at the seminar, they were having pregnant women even do the workouts. And I was like, I don't know about that. But these are the things that you can utilize here because, again, all bands are not the same. And my big concern, again, is I wanted safety. And I didn't start talking about these. I mean, literally, I left that seminar, I bought them immediately. I waited to get them. I waited 1 month. I didn't even talk about them. I have certain friends and I have old patients of mine. They're always into, like, new health stuff, and they know I've always been like a couple 2 to 3 4 years ahead of the curve just because I'm in that world. And they're like, let me know anything new you get in your hands on and you're doing, and you put your gold stamp of approval. I want it. So I'm like, okay. So I waited a month. I tested some things out, and I'll share someone's story in a minute here, a little bit of what they went through. And so long story short, I saw amazing results in a month, and I said, wow, I really like this. And so told some of my patients, my coaching clients that I work with from a nutrition standpoint, nutrition, vitality, and health, and some friends of mine. And I said, you got to get this. This is the next thing. And some did, some waited, and they got their results, and they were blown away by it too, because it's so different here. And I'm going to share with you guys in an email after this. If you register, you'll get an email to see how they're actually done. I'll have Dr. Mike and Dr. Jim, who are the owners of B3. They'll talk about it, and they'll show you how to do these and so forth, and how to do that and whatnot. But this is why it's all about you making sure that you know that you're getting a good brand and they're safe. That's the biggest thing here. So, it's before the workouts used to be, I remember working out and it was like a good 45 minutes. In my early 20s, I started to get into these 21-minute, 25-minute workouts. But even that, the B3 bands, the cuffs by far, because I had to work out about 5 days a week. 4 to 5 days is what my workouts were. And I had to take a lot of time. So some people you get stuck. You hit these walls, right? Sometimes you get poor joint, you get joint pain, you get older. Sometimes you feel it more. You can't stress those joints. I can't lift. I mean, I could, not that I can't. I have the strength still. Lift like I was in my 20s. I just feel a little different on the joints than I used to. And so it's like, I don't know how much more stress I want to be putting on these joints. I'd rather be doing something that's more giving them longevity. And that's what BFR does, because now it's more about under 20 minutes a day. You can do as many times as you want. And when you're looking at that, like before, somebody was like having different types of, individual who's trying to work out this story here, 90 minutes a day workouts, 5-6 days a week, stuck, not growing, 5 months, getting joint pain, no poor sleep. And all of a sudden now he's under 20 minutes a day of workouts, 21 inches total loss in body measurements, lost 12% body fat, gained 9% lean muscle, bursitis in the left shoulder, gone, sleep restored. And that's just from 90 minutes a day to under 20. From stuck from 5 months to 21 inches, lost 9% lean muscle gains. And that's not a different workout. That's just a different tool. Ingrid, another person, had a 1 hour plus hour strength training. Very big into the athletic, working out. Standard weights, 10 pull-ups, all these different things. After 2 months, with the bands, 15 pull-ups, 50% increase in upper body strength, cardio capacity improved without additional cardio work, lost 3 pounds, leaned out around midsection, 50% increase in upper body strength in 2 months without doing more. That's the growth hormone going to work. At a patient, I recommend this, was amazing. He did 70% less weight than his normal training load. He's been working out for years, and I told him go 70% less. He thought I was crazy. I said, pump the reps of this. You're going to do this much in a day. That's all I want you to do. Do that for the month. Measure your arms before, measure after, because I said it shows that, based on their research and studies, it shows that their data shows you'll gain about an inch on your arms by just doing this stuff. He thought I was crazy. I said, do 10-minute sessions. So he did about 10 to 12. His legs were about 12 minutes long, but 10 minutes is where we kept it, 3 to 4 per week. And he remeasured in 21 days. I told him to do it in a month. He did it in 21 days. And he's like, hey, man, I'm over an inch on my arms. And I looked at him. I said, you didn't just work out and then do it, did you? He's like, no. I did arms like a couple days ago. And I'm like, and you have an inch growth? He goes, yeah. I was like, dude, that's awesome, isn't it? And so he was very fascinated because 3 weeks, 70% less weight, not more effort, smarter effort. And that's what the growth hormone looks like when you're utilizing it. I saw the same thing. I actually took these. So after about 6 months of using them, I started to go, man, I was getting into more legs, and I was like, I'm going to do legs in the front and the back. And I was like, okay, how can I get better muscle quality out of my legs? So I'm like, I'm going to do the BFRs, and I'll do my anterior chain and my posterior chain as much as I can, and I'll split those up into 2 days. And here's what the fascinating thing was. In just 3 months, I put on about 23 to 25 pounds of muscle on my legs in that process. I weigh more now than I've ever in my entire life, but not in a negative. And it was more like I didn't expect it. But I put on a lot of inches I put about 2 inches on an inch and a half on my legs, my thighs. I put an extra inch on my calves. And it was amazing. And I'm like, wow, this stuff. And all I was doing, my wife was even shocked. She's like, you've only been working out 12 to 15 minutes a day on your legs. if you total it, it's 24 to 30 since I'm doing front chain and back chain. And I'm like, yeah, that's pretty much it. I think this stuff works pretty well. And so it is a game changer. It could definitely do that. So like I said, I'm going to share the video with you, Dr. Mike and Dr. Just to save you guys time. I'll send the video via email. You can see how they do it, the instruction, how they look, or what they look like, and so forth. They want to put that on here in this episode. But this is where we start to look at training in a different way. This is a tool that you can use to train smarter. You put, again, 70% less load. Okay, so to put this in the numbers, if you could, let's say you bench press 3 sets of 10 at, let's just say 200 pounds. Okay, well, 70% less means you're going to go to 60 pounds for bench press. It sounds crazy. I know, trust me. But here's the cool thing. You're only going to do 60 pounds. Now imagine how much better can you be with your form at 60 pounds? Well, if that's too much, let's do biceps, right? 10 pounds. Let's say you curl 10 pounds, you do a set of 10. Now you do 70% less. It's only 3 pounds. How much more precise in your form can you be? So this is what really sold me. Yes, the growth hormone I told you sold me. The nitric oxide, yes, sold me. That was a big. Healing my body, taking less stress off it, yes, sold me. Here's where it got me. And I've been lifting since I was 13, and I'm very big on form. And I will tell you, when you fatigue, I don't care how good you are on form, when you start fatiguing, form is lost. The more you fatigue, the more loss of form. What I found interesting about this is when you're working out with this, it's weird. It's a different burn. It's a burn where you're like, I can still move the weight. I'm a little slower, but I can still move in full range of motion, but I am exhausted. Like my muscles are shot. They can't work that much. And that's where the difference comes in. So you're going to be working these muscles and you can still maintain form. And that was very critical for me. And that's what's more important to me because I want to move the muscles and the joints in a specific way so I can get that full range of activity on the muscle. So I'm creating better muscle fibers. I'm creating better muscle tissue. Not even talking about the growth hormone, the nitric oxide, and all the other things that come with that. So imagine that perspective when you're looking at that. It really does become a game changer when it comes to working out and doing those kind of things and so much more. So, again, I'm going to email you the demo on there so you can get an idea of it. But, again, the thing you want to look at is you got 40 years of peer-reviewed science used by Olympians, the NFL, the MLB. There's more teams and more sports and athletes are taking this on because they're seeing such a great result from it. Like I said, the Chicago Cubs use it. The U.S. military rehab with it. You get growth hormone surges at 200 to 300% at 20% the training load. Okay, you got your nitric oxide activation, you got your vascular and your cardiovascular health sessions. You're getting such great improvement with there. It cuts your time in half. Now, I've been talking a lot about strength resistance. I know there's some people who like running. You can use this in running. You can shorten your times in running. So I'm not a runner. But I go through a weird period of time in spring. Don't ask me why. My wife and I were laughing about this a month ago, where I'll run like 2 miles, 2.5, 3 miles a week. It's not crazy. It's 2 sessions, a mile and a half roughly. And then one day I looked there and I said, I'm not going to do these miles anymore. I'm going to run a quarter of a mile with the bands and see how I do. And so I did. And wow, that's a different burn. Let me just tell you. What I noticed, though, is I like experimenting. So I said, okay, I'm going to do these for 3 weeks, and I'm going to do twice a week, about a quarter to a third of a mile. And I want to retest myself time-wise, running again, then at a quarter to a third. Now you can say, hey, Doc, why didn't you go to a mile? To be honest, my cardiovascular system wasn't ready to handle that mile. This is a whole different strain on my legs and my body and so much more. So I wanted to just take it easy. So I did that. Long story short, I went to go rerun. Massive change. I was able to run longer, better, had more cardiovascular was where I noticed the big one, but also muscle strength was there. I can push a little faster, especially when I was going uphill or something like that. But the bands, they matter. I want you to understand that, and this is why I'm a big component of them. The B3 are the only scientifically tested bands to not occlude the arterial flow. As soon as I saw the research and I read it, I was so, literally that night I came home and I ordered them. My mom was like, how much did you buy them for? What'd you spend? You didn't even ask. I'm like, I know. You'll thank me in the long run. So again, 10, 15 minutes, 3-4 times a week. I've done it for 2 years. It works. It continues to work. I've actually done it rehabbing different areas of my shoulders. Not that I had issues with them, but I usually do a lot of work on my shoulders and certain areas of my body. There are certain things I'll do with my twice a couple times a week, and I was able to fine tune it. I can even do. I'm putting together something where I've used them for rehabbing my spine, like getting better neck extension and working on more of my core as I do it. If you don't like core, the bands make it a lot easier. I can do a plank for 45 seconds to a minute with the band on, the cuffs on, and all of a sudden I'll be done and I'll be sore the next day. If I do 2 rounds of that, I'm paying it the next day. If I do 3, forget about it. I had a friend of mine who got the bands. I told him how to do the workout to start. He didn't listen. He went and did a normal workout for like 20 minutes. And when he texted me later, he goes, man, this was the best workout ever, the worst burn, the hardest, the most intense burn I've ever had. And I was like, what'd you do? He goes, I worked out for about 20-something minutes. I said, 20 what? He goes, yeah, I was lifting, I was pulling the weight, I did my normal workout. And I said, what happened to me talking about doing it in a specific way? I told you got to take it easy. He's like, why? I said, call me tomorrow and let me know how you feel. He texts me and he goes, I can't move my arms, I'm so sore. I looked at him, I said, this is a lot more intense than you think, so it's a lot easier. So if you're ready to learn more or you want to order your own set, you got a QR code right here. I will send an email for a link that you can go to because you have to be able to get those. But on the QR code here, you get full access. You can learn more about them. There's videos on them. There's the research there, who teams are using it, what people, their stories that they've done, and so much more. When it comes to that, it'll take you right to my page, and you can go ahead and look at all that. If you have any questions before, you can reach out to me directly. Email me at info@wellnesspathchiro.com. You can text us at 865-214-7438. I'll be happy to talk to anyone. I recommend a lot of this to patients that I've talked to here and there. A lot of people who do get into rehab, this is really good. If you're an athlete, unbelievable. If you're older, especially if you're pushing the 50s, 60s, and 70s, you can really, really put these to work, and it's a game changer. This will be something I can use for the rest of my life. And my kids, when they get older, they're going to use them. I want them to be able to do this. I mean, one of the chiropractors I know who has his kids, she wanted to work out. She's like 12 or 13. And he's like, hey, put on the leg straps and just do air squats. She did air squats. She did some planks. She did a couple other things. It was about 8 minutes. He said, hey, you're good. You're good to go. And that was it. And he plays, the guy who I learned these from, he's in his 50s, and he plays baseball still. And he noticed, because he's been using them for like 5 years, towards the end of the season, most guys have injuries. They can't go as long. And he gets better as the season goes because he uses the cuffs more and more and more in his training, in his throwing warm-ups, and his throwing routines, and specific workouts that he does. And he's fine-tuned it. And he goes, I love it. It's 8 to 10 minutes. And he looked great. And I was like, man, that's another thing that sold me. I'm like, I could tell his skin, his eyes were clear. He had all the, you can never judge a book by its cover, but there are certain key things you can look for from like we call it facial diagnosing, face diagnosing. You look at the face and you can tell the clarity of somebody and so forth. And he had those things, which was a game changer where we thought, and I was like, this is definitely something that I'm looking at doing and so forth. So check it out there. You got the QR code there that can help you with that and so much more. If you have any questions, reach out to me. But I hope this enlightened you a little bit. Again, it's all about working smarter, not harder. Save you on time and get the gains just as much or even better, and save on the joints and add more years to your ears and longevity to everything that you do. I want to thank you again. Appreciate you guys as always, and I look forward to seeing you in the next workshop.